All right, folks, check your refrigerator because tainted ground beef still being recalled. The USDA says National Beef is recalling 60,000 pounds of beef after bacteria was found in it, and some of that ground beef was sold right here in South Carolina.
It was sold mainly in the Southeast at Winn-Dixie, Publix, and Kroger stores. There have been no reports of illnesses so far. The company says they are still investigating.
This is the second major meat recall in weeks, and it's just another reminder, folks, of how important it is for you to properly cook your meats.
Dr. Jennifer Nelson, a family practitioner, is here with us today to tell us about the symptoms associated with E. coli contamination. So what should we look for?
Well, sure. Usually you're going to get symptoms anywhere from 1 day to 7 days after you've consumed contaminated foods, and that usually results in nausea, maybe some vomiting, abdominal cramping, and then diarrhea, which can be mild or it could be really severe diarrhea, and usually you'll see blood in there.
Now, Dr. Nelson, is this E. coli problem worse sometimes for young children were they to get it?
Absolutely. Patients who are usually affected the most by this are young children, elderly patients, and those with immunocompromised states.
You can't always tell whether your meat is contaminated, even despite these warnings, as another type of meat may have E. coli as well. So it's important to cook it.
Absolutely.
Thoroughly.
You want to cook it thoroughly to 160 degrees. You cannot tell if something is contaminated just by looking at it.
Check those burgers on the grill.
That's right. You can only know for sure that it's 160 degrees with a meat thermometer.
So make sure you do that and make sure you use that thermometer. Not to belabor the point, but if somebody does get E. coli and he or she has a compromised immune system or is, as you say, elderly or very young, this could be a killer, could it not, E. coli?
It can. The toxin that's produced by this bacteria can cause renal failure in patients who are susceptible to the disease. For someone who is healthy, they may have symptoms, but they'll resolve within a week.
So how do you tell the difference between a little stomach bug that your child may have quickly and something that you may want to call your doctor's office about?
Basically, if they're getting worse, not getting better, you're seeing blood in the stool, you need to get them to the doctor.
Thank you very much, Dr.
You're
Jennifer
welcome.
Nelson. Thank you so very much for joining us. And to make sure your ground beef is safe to eat, cook it until it reaches an internal temperature of 160 degrees.
To keep bacteria levels low, store it at 40 degrees or less. Use it within 2 days, folks. If you don't, then freeze it.